Hey everybody, welcome back to A Brief on Grief. So the last several weeks I've been pondering and reflecting a lot on, I've been preparing for a couple projects the last few weeks on looking at my job as a healthcare worker and the different challenges and stuff that I face, daily, and then any special stuff that's kind of come up during this pandemic. And of course, as I do through this whole experience with grief and loss and how it's kind of changed the way I look at the world, changed the way I look at a lot of stuff, I look at life and experience life now through the glasses, through the eyes of grief and loss. So when I was realizing that every patient that I see in the hospital, in the stroke and brain injury units that I work on, as well as kind of, I think generally anybody that ends up in the hospital with something serious enough that they have to stay in the hospital, that everybody is grieving because they're all dealing with a scare, a change in their life. They're dealing with a change in their health, maybe and a loss in their health. So that's the primary loss. But then when I think about kind of the whole situation, I think about, yeah, it's a whole change in your routine. If you have to spend some time in the hospital, so you're like losing your routine, everything that is changing, you're eating different food, you're trying to sleep and be around people you're not used to. You may, especially during COVID, this was a big one, you're not maybe able to see or have your loved ones around you at this very scary time for you because they're limiting visitors. So there's a lot of loss involved with having a stay in the hospital. And I never really thought about it in terms of all of that, in the aspect of grief and loss, to that degree until the last few weeks as I was kind of preparing for this project. And in that, I realized also the way grief is kind of distorted in the healthcare system. It's not seen as grief. It's not noticed as emotional loss and people challenging with or having difficulties with emotional loss of losing their health or other things that are involved. And in some of the stuff that I've learned in grief and loss too the last couple of years, there is a big kind of what they call healthcare distortions, in that grief is often mislabeled as like depression or anxiety, or in like kind of non-medical terms, in charts and stuff as non-compliance or a difficult patient, whether it's in charts or just verbal interactions, or somebody maybe that's like emotionally sensitive. I am so apparent, I've been so aware of it, like in the last year or so in my job, and really actually using those opportunities to talk with people about grief and loss. So some coworkers, but as well as patients too. That's just the way I live every day now. And it's actually completely changed the way I do my job and as a healthcare worker, as well as my personal life as well. So I've been able to bring this passion for bringing awareness to grief and loss into my job. And it's made my job so much more rich for me, so much more heart expanding. And I've seen some of the effects that it's had with the people that I've worked for, and it's an amazing exchange of love and energy back and forth. And it's like I say often, probably in these videos, it's a completely different way of living for me. And I'm not only doing that in my personal life, but it's completely changing the way I do my job. And it brings so much more joy and meaning to my job. But the healthcare distortions is something that really like troubles me, but at the same time it adds more passion to the whole path of bringing awareness to grief and loss, and that it's often hiding under so much of our struggling as humans, and it's not often recognized. And unfortunately, it's the lack of recognition of it that adds to the stigma and shame in it all, especially coming from the medical fields, because often people come in to the hospital or come to medical personnel with respect and looking for kind of guidance and with the way to process something that's going on in their life, a change in their health and whatnot. And unfortunately, when it's an environment that's not actually honoring the pain and the struggle and the grief that goes on with the loss of your health and other things, when you find yourself in the hospital, or when you find yourself trying to recover after a stroke or some serious injury, it ends up being not a very safe environment always, or very supportive environment to always express that stuff. I am trying to change that. I'm trying to be that energy and that presence for people, for it to be okay to feel that stuff, and also for me to keep my heart and eyes open to recognize that when people are grieving, and to give space for that. I've been told that that's not really in my scope of practice, but when I think about that, I acknowledge where that's coming from, and I realize that, and know that there's social workers and other things that kind of are more specialized in the area. But I also stand back and I think, well, I don't just work as a physical therapist in the scope of physical therapy. I work in the scope of the heart. And when you're working with people, I don't think it's helpful to be super structured in what is okay to give space to and what is not okay to give space to. Because honestly, my role there is to be a presence that helps encourage people to have faith and hope that they'll be able to regain some of their function that they've lost, and to be a presence and a guide for that. And you cannot be that position without honoring the emotional health of somebody as well, because that plays a role in absolutely everything, in their participation and motivation to want to even do that. So it's not separate for me, it's one and the same. And I can't speak for anybody else, but I will be continuing to practice in the scope of the heart, because how healthcare distorts grief, it's not helpful for any of us. And approaching my job from the eyes, looking in a world through the eyes of grief and loss, so that I can not only recognize it in patients, but also see it in my coworkers and in myself, in some of the struggles that we have doing our job. It's just a more wholehearted, loving way to live, and that's the only way I want to live anymore. So yeah, that's that. Thanks everybody. See you next time. Bye.